Hello, I'm Dr. Collins, and in this clinical skills video, we are going to explore a bedside neurological examination known as Hoover's sign, which helps differentiate between true organic neurological lower limb weakness from functional or non-organic weakness. This test is particularly useful in situations where the clinical picture is unclear. For example, when a patient presents with unilateral leg weakness that doesn't fully correlate with anatomical pattern or objective neurological findings. Hoover's sign is considered to be highly specific for functional weakness, which means that a positive result is strongly suggestive of a functional diagnosis. However, it has moderate sensitivity, meaning a negative result does not rule out functional weakness. To perform this clinical exam, ask your patient to lie down on a flat surface and hold their legs up from their heels. In healthy individuals, when a person attempts to lift one leg while keeping the knee straight, there is an automatic and involuntary extension of the opposite leg. This is called synergistic contraction. So, if there was no neurological or functional issues, the examiner would ask the patient to lift one leg up without bending their knees. And what would happen is that as the patient lifted up their examined leg, the opposite leg that you're holding would create a downward pressure into your hand. This is a normal finding, and there is no neurological or functional issues. Now let's explore what Hoover's sign negative means, which indicates that there is true neurological problem. Let's say that our patient reports weakness in their left leg. You ask them to lift up their left leg without bending their knees. If there is true neurological deficit, the patient may only be able to lift the affected leg weakly or not at all, but you should still feel that involuntary downward pressure from the opposite normal side, because the normal motor pathways are still being activated. This suggests that the Hoover sign is negative and the weakness is organic, in other words, neurological. Now let's explore Hoover's sign positive, which means that the weakness observed is functional, in other words, non-organic. When you ask the patient to lift up their affected leg, their leg may not lift up or lift up very little. But the important thing is that you do not feel or feel very little downward pressure from the opposite side on your hand. If the patient attempts to raise the affected leg without any downward pressure from the opposite side, this constitutes a positive Hoover's sign, suggesting that the weakness may be functional rather than neurological. In other words, Hoover's sign is positive and the clinical finding is unlikely to be neurological. Thanks for watching. If you like this video, please like and subscribe. And don't forget to check out our other clinical skill videos, our quick medical mnemonic videos, and the longer in-depth clinical concept videos. Good luck!